3 times likely to have low HDL. HDL is your good cholesterol. And 2 times likely to have high LDL. LDL is your bad cholesterol. Briefly touching on hypertension, 43% in men, 35% in women. Well, those who eat a lot of fruits and vegetables in their diet, they have much lower incidence of hypertension. Again, yes, we eat lots of fruits and vegetables here and there, but it depends how much you're eating in your meal. And hypertension in South Asians is much younger in onset. Little information pertaining to us women, menopause. So till you are menstruating, you have the estrogen, you have the progesterone. These are the hormones that prevent heart disease. They actually help you. So very few women you would see, unless they have really uncontrolled other risk factors, have heart disease when they're menstruating. It is with the onset of menopause that all your risk factors just double up. There's increased fat deposition with menopause. I hear my parents, my mother-in-law, everyone say, oh, ever since I started menopause, my weight has picked up. I cannot control. My body has just changed. That's because of there's increased fat deposition. There's increased calcium in the arteries. From the masala study, what we saw, of course, it was associated with higher BMIs, higher abdominal fat deposition. As soon as menopause starts, women start becoming bigger. There's higher hyperlipidemia, cholesterol levels were higher waist circumference. So remember the apple, the waist hip ratio, that goes up. And so there's higher incidence of death, heart attack, everything goes up. So if you're menopausal, you have to be more vigilant. You have to be more careful because your risk of heart disease definitely goes way higher than before. And of course, there's increased fat deposition, there's increased incidence of diabetes because fat does not let your insulin work the way it should. There's type 2 diabetes in which there's insulin resistance. Family history, genetics, things again, which we cannot control, but things to be careful about. Things that should ring a bell that I need to see a cardiologist. I need to see a family practitioner. I need to get my risk factors under control. I need to be more cognizant with my health. Did your uncles, aunts, grandparents, anyone in your immediate family have heart disease? If your physician does not ask you this question, make sure you bring it up. This is a question I ask every single patient. Well, they say that, yeah, someone had this, but were they younger? Because if it happened to your aunt or your uncle in their 50s, it could happen to you in 40s. So how old were they when it developed? And it is very different than how old were they when they were diagnosed. Because when you find out does not mean is when you have it. When someone comes with heart attack and we see that, oh yeah, you have hypertension, diabetes, it probably developed 5 years before the heart attack was diagnosed. So things just to keep in mind and make sure you share it with your provider. So a lot of information that we shared, just few things that I want top takeaways from this. Diabetes screening, it starts young, does not matter. You're 40, you're 50, no, it starts young. These are the normal thresholds, normal cutoffs, your A1C levels, less than 5.7. But we have noticed, again, yes, don't ignore your A1C level. If your doctor tells you you're pre-diabetes, take it very seriously because from 5.7 to 6.4 in 3 months, it can happen drastically. Studies have shown that just a little higher than 5%, which clearly are not abnormal in our current lab status, but for South Asians, these are enough to cause heart problems. So your A1C level could just be 5.6. It is not going to flag, it's going to be normal. Even if it's 5.7, it's going to be normal. But with all the other risk factors, I would still be careful. Now, what is a normal threshold? We don't know yet, but lower it is, better it is. Maybe 5.2, maybe 5.4. Unfortunately, we don't have studies to prove, but definitely if you are in pre-diabetes or diabetes range, you have to work on getting these numbers much, much better. Move, move, move. Well, our guidelines clearly recommend for everyone, this is not any different to a South Asian, but 30 minutes, 5 days a week, 150 minutes a week. Standard thing I tell all my patients. Yes, we have a lot of work from home situations. We have a lot of working moms. We have a lot of other things in mind. Honestly, I'm culprit for this too. Every day you decide, oh, I'm going to work out for 30 minutes. It's really hard with the life we have, but this is something we have to do for ourselves. Same things that, I hear all the time. I've seen a few family members. Oh yeah, you're not obese. You should be fine. Oh, you don't need to exercise. You don't like, have you seen my visceral fat? No, what you're seeing is subcutaneous fat. So your risk is still much higher. The fat stores are deep within your body, things that you cannot see. So working out would not be for that subcutaneous fat, it's for these deep stores that you cannot do anything. Typical meal that we all love. I'm probably going to have one tonight too, but these are the things that we eat. Problem happens when East meets West. What is this? We have our own patterns of food. A lot of carbohydrates, love chapati, love rice, love naan. Lentils, yes, they have good source of proteins, but also have a lot of complex carbohydrates. We eat ghee. Oh, ghee is good for your bones. Ghee is good for growing children. We have a lot of butter. Most of us are vegetarian. We don't have a good, like all the lean meats, like even if we eat, it's goat and those kind of things. Along with that, now we are here. We are, in the country of abundance. So we see a lot of dairy, we see a lot of fried food, we see pizza, pasta, potatoes. So this is where our culture meets the Western culture, and both together, it's just a setup for failure. So I like to say when the East meets West, that's a disaster. Things that we can just keep in our mind when we are serving ourselves, our dinner, lunch, whatever. More than half definitely needs to be vegetables. A little bit portion can be fruits. You can combine this in half and say half of it should be all the vitamins and minerals, that's fruits and vegetables. Half should be whole grains. And whole grains would be whole wheat, or chapati. You can have brown rice. Nothing should be refined. No refined flour. No white rice. No white bread. Yes, we all love dosas, but limit that. It all comes in whole grains. And then there's healthy protein, which if you're vegetarian, you're stuck with beans, you're stuck with nuts. If you eat a lot of fish, it comes here, which is really good. And of course, you avoid all the processed stuff. And then healthy oils would be, olive oil. And you limit the amount of salt, you limit the amount of butter, ghee, and plenty of water. So just to have a mental picture whenever you're serving yourself, is half of my plate fruits and vegetables. Yes, of course, fruits you have to limit because they come with their sugars too, is less than half. So is it more like 1/4 of my plate? Whole grains, which includes your chapati. So have one chapati with half the plate vegetables. If you're having chapati, then cut down on the rice you're eating. And then does 1/4 of my plate have protein? At least, vegetables, half with brightly colored vegetables. Proteins, we talk about edamame, actually pretty good source. Tofu, we have kidney beans, pinto, black beans, lentils. We have a bunch of these varieties. Fat, always think about the healthier option, extra virgin olive oil, which actually I've been using for the last 2 to 3 months for my daily cooking. Yes, it burns pretty quick, but I don't feel any different in whatever I'm cooking. So if you can just use that for your daily cooking, that's best. Avocado oil, avocado slices, nuts, avocado, these are all HDL. These increase your HDL, they increase your good fat. Fiber rich grains, so brown rice, and there's wild rice, and there's quinoa, and then green peas, sweet potato, don't take their skin out. And then healthy dairy alternatives, which I've written, but unfortunately that's going to be very difficult for a lot of South Asians, including me, to adopt to use soy milk and almond milk. I mean, we are so fond of our tea and coffee that it's going to be a little difficult, but you can at least use 1% or zero fat milk. All right, coming to our risk factor summary. Again, this is going to be a little more medical stuff, but I think we have hammered it enough that now you guys will be familiar. Yes, we have high prevalence of diabetes. We have impaired glucose tolerance, meaning our body does not know how to use all that extra glucose because of insulin sensitivity, which is all related to the high fat. Body does not know how to use insulin. We have triglycerides are high, our HDL levels, which is the good cholesterol, that is low. Obese, overweight, yes. Remember the lower BMI cutoff? We have that. Hypertension, use of tobacco products. I don't know how prevalent it is around where you guys are, but I recently went to India, but actually last month, and I'm from Gujarat. Every other person I saw had some form of tobacco product in their mouth. It amazed me how, yes, we've, I mean, it might not be very common, but I was amazed how everyone had red teeth and red mouth, and they absolutely love pan and tobacco and supari and those kind of things. Low physical activity, yes, we love to sit down and watch TV. We have family history of coronary artery disease. Good to know the family history. You need to know the status, what your generations are, siblings, anyone. And, our traditional, the East meets West, the diet. So we constitute 25% of the world population. 60% of the heart disease comes from us, which is probably the highest. We develop heart disease 10 years earlier compared to everyone else. Little less than half their normal weight, but they have more than 2 risk factors. There's high prevalence of diabetes, blood pressure, cholesterol, and most important, 40% chance of dying from heart disease compared to anyone else. This is something, yes, if you present with a heart attack, people put in stents, you're saved. But for whatever reason, based on masala study. There's one other study in which thousands of South Asians, masala did not have anyone with events, but there was just a little extension of that study that was done on people with heart events, and compared to anyone else, those who presented with heart attack, 40% higher chances of mortality, meaning 40% higher chances of dying than anyone else with heart disease. Well, so I have a little women's heart and prevention clinic with Ascension. As Sunita pointed out, I, along with all the pregnancy, menopausal, those kind of, I definitely am keen and fond of treating South Asians, people like me, even if they don't have a family history, but who have risk factors, or even who want to be screened for risk factors. What are my chances of having heart disease in 10 years? The medicine is so advanced that we definitely can do all the screening and risk assessment, which is not 100%, but it is very close to 90%. And just like to thank you all for being here and spending your weekend with me.
Thank you. Yeah, that was incredible information, especially on this Heart Month that we celebrate in February. The statistics are crazy about South Asian people and the cardiovascular risk. It's scary, actually. We do already a couple of questions. This is from Rajneesh Kiran. Rajneesh, do you want to ask yourself? Unmute yourself if you want to talk to her directly, or I can ask too.
Yeah, you can ask. Go ahead, Gigi.
So Rajneesh Kiran is actually our yoga instructor. He has been serving the wellness team selflessly for many years. He's very actively involved in many of our wellness initiative. And he has some questions, as you all see. He was asking, is there a way to diagnose fatty streak? Are they reversible? This is his first question.
So fatty streak to diagnose, unfortunately, no, because we have coronary calcium score, which looks at the calcium. It's, when you have the fat, macrophage, and the calcium, that's the only thing we can see. There's no way to diagnose a fatty streak, but that is the most reversible part. So hopefully in the next few years, I'm sure there will be a way in which we can diagnose the fatty streaks as well. But as of now, no, we don't have any testing for that.
And Rajneesh also has another question. Is coconut oil safe to use to prevent, or what type of oil can we use in cooking to prevent fatty streaks?
Unfortunately, coconut oil, just like ghee and all the canola and vegetable oils, these are all saturated ones, and yes, you can use it in moderation, just like I tell all my patients, if it is something you cannot forego. But the only two oils have actually been very, very helpful and studied are the avocado oil and the olive oil. So you find a lot of extra virgin with blended olive oils. These are the ones you can definitely use for cooking, because then they don't what do you call, like with temperatures, they're not that sensitive as extra virgin olive oils, so you can still cook with them. But coconut oil, I mean, if it is something you definitely cannot go without, then just very little compared to what you think your food would. But definitely fried foods are a no-no, so it doesn't matter what oil you use. Yeah.
All right. Any audience, any more questions? This is the time you can ask.
Yeah, this is Rama. Can you hear me, Sunita?
Yes, Rama.
Yeah,
you can.
Thanks for forwarding me this invitation. So yes, and yeah, Thank you, doctor, for your time and a really good presentation. The question, I think, part of the first question or maybe extension of that question. So you mentioned that obesity are two types. One is external body fat and internal body fat. And maybe you might have answered this question or not, but just want to clarify on that. Is there any way we can find the internal fat? Are there any tests that we can be done to find out, and how can we get the treatment done for that?
That's a very good question. When we do echocardiograms, ultrasound, we can definitely see the internal fat around the heart. It just appears, like there's a big fatty blob outside the heart. So that would be the only one that I can think at the top of my head in which we can see the fat, the visceral fat, the internal fat. Otherwise, around the liver and those things, it's very hard. I mean, you can have a full fat scan and in which they diagnose, but is it something in guidelines? Would your physician do that just for this? I don't think so. They usually focus more on the external fat. If they're doing, echocardiogram, ultrasound for some other reason and they find this, then definitely to keep in mind.
Mm-hmm. And one other question I have is that, I'm free to share my health issue here so that, you'll get some idea. So I've been doing exercises like, I love doing Zumba and I go to gym and everything. But within BMI, within BMI, I have no issues. But the thing is that when I go for annual checkup, my cholesterol level actually always in red. So that actually little concern. So I've been seeing that from past few years, but finally my PCP prescribed, the cholesterol controlled the medicine daily that I'm taking. So that is only the way that we need to follow. Is there any other way we can, like as you mentioned, the hereditary from our South Asian community, the way how we our body built, or maybe how we born, maybe that's how it is. So is there any suggestions on that, like what we can do?
So that's good that you're good with your diet, with your exercise. How is your diet? Let me ask you that. Do you think you fall in the very good category, or you think you're good, or still you think there are things that you can be better at?
Exercise, actually, I'm doing regular every week. Very good, actually. I'm doing some body pump classes in YMCA. I'm also taking Zumba classes, and yes, I'm good with that. So, are you talking? Is this question related to the diet? Okay. So, diet, actually, last year, actually, what I did is I cut down rice. Whenever I go to friends' place and parties, I'm eating rice, but I was not eating a big amount of rice. But this year, actually, from January 1st onwards, I stopped eating rice. I'm eating quinoa and, with curries and those kind of things. And also I cut down completely milk this year. I'm just drinking only oat milk this year. So that, I'm fan of like, coffee drinker. So I don't want to give up that taste so that, but it was hard this year to cut down the coffee with adding sugar. But this actually took me 1 year to get adjusted to the taste like oat milk with coffee, filter coffee. And then now I'm balanced and, got used to it.
So it seems like you're doing really good with both diet and exercise. So unfortunately, the only way that your numbers would be better would be a medication. I know a lot of people. You actually brought up a good point that I'm going to, emphasize during this talk. I prescribe statins to my patients. Statins are the medicine for cholesterol. Sunita and I would both agree that these are cardiologists' best friends. These are the medicines that are, when you look up online, you'll be shocked and you're like, why are these medicines even here? They would say so many side effects and how bad they are, and they cause diabetes, and they cause dementia, and they cause yada yada yada, things that are really bad. But these are the only medicines that actually, amongst all the medicines, including baby aspirin, these are the ones that are top of the list to prevent heart disease, to prevent you from dying, to prevent from heart attack. So if you are on a cholesterol medicine that's helping your numbers and you're so good with everything, I would just take it. I don't think it is you or your fault in which, why your numbers are that bad. It's unfortunately just the genetic makeup, and things that are not under your control. But having said that, when you're in this, on this cholesterol medicine, don't ease up on the other part, like don't think that, oh, I should stop working out or not eat. Like continue that along with the medicine and just
Yeah.
get the
Yeah.
most of the medicine.
Thank you very much. Thanks for your time.
Of course.
Good questions, Rama, and thank you for coming forward with the questions. And Dr. Shaila Shah, we have a few more questions from Sri Lekha. She was asking us, how do you know if you have visceral fat and how to lose it? That is her one question. And she has two more questions also. So we'll answer this then.
So visceral fat is not something you would be able to know otherwise unless you get some sort of dedicated study for other reason, like if you're having, and ultrasound of the heart, ultrasound of the liver, and it mentions in your report, which again, people don't emphasize because they don't deal with South Asians, that there's a prominent fatty streak or there's fatty thing, you wouldn't know, or unless you have some surgery and they open you up, which we don't want to know like that. There's no way to know, and there's no way to prevent, because it is something that would not be under your control. What is under your control is just the outside body fat. But the thing that definitely helps with the visceral fat is to make sure that you definitely don't have the outside, the subcutaneous fat. If you have that outside fat, definitely you have a lot of inside fat, if that makes sense. So if you, what is it under your control is what you see outside, and make sure you're good with all that. You probably won't be able to know what's inside unless you get some testing done for some other reasons.
Exactly. And Sri Lekha was also asking, how many eggs a day or week are ideal, and is coffee bad for heart?
Coffee is not bad for heart. There are still there are studies which will say coffee is really good for your heart, coffee is really bad for your heart. The only thing that coffee does is, it causes a lot of sympathetic activation. I see a lot of women come in with palpitations that, oh, I feel my heart going too fast. I feel my heart skipping beats. If you are one of them, then coffee is not your friend. These females or these patients, they skip coffee and perfectly fine. And coming to eggs, one egg, complete egg, one a day, but you don't have to limit the egg whites. So if you are eating, let's say 5 eggs a day, if it's all egg white and just one yolk, that's perfect, because one yolk gives you the amount of cholesterol for the whole body. But as many number of whites as you want. There's, of course, everything in moderation, but I wouldn't use a complete egg more than one. So
Only Dr. Shailisha, we have one more question. So this is from one of the Manofa member. She's asking premature symptoms of cardiac arrest that we need to watch.
Cardiac arrest would be a little later, but yes, premature symptoms of heart attack would be, you are limited in your daily activities. I mean, of course, yes, if you're not walking, you would be deconditioned and you won't be able to run a marathon in day one, but you're doing this on daily basis and you feel like all of a sudden you're getting too tired, you cannot do things that you were able to do before. You feel like you are more short of breath, even though you don't have cough, cold, or any other symptoms. If you feel like you've noticed that a lot of times I'm having, some tingling in my arms, I'm having some heaviness in my shoulder, my jaw, then these are the things. Or if you feel like whenever you're exerting. So most of the symptoms you have to think about are exertional, because that's when your body needs more blood. And that's when you would, start having more symptoms. So it's exertional shortness of breath, exertional indigestion, exertional heaviness in your chest, like or shoulder tingling. So these are the things you definitely need to watch for. And then breaking out in sweats. Oh, I just walked to the mailbox and God, I was like all sweating.
Well, this question was from Simple, one of our Manofa secretary for 23-24. So Dr. Shah, you were mentioning that it's not the old age which is predisposing one to cardiac conditions. Even the cardiac situation or cardiac symptoms can show up as early as 18 years of age. So ideally, at what age in teens do you recommend screening for cholesterol?
So now the guidelines have changed, and even like people as young as 25 years, when they go to their primary care, they get a full lipid panel. If everything is perfectly fine when you are in your like early 20s and your family, you have good genes, no one have, any risk factors, it's okay to just do it every 10 years to keep an eye on it. But if you know that someone in your family has, had a heart attack in their 40s, or like stroke or hypertension at an early age, then I would definitely do not like every 10 years. You start at like 25, but then you don't, you do it every 2-3 years just to keep an eye that you are within the normal range. So as early as early 20s, that's perfectly fine. And of course, there are some hereditary cholesterol abnormalities. Again, South Asians, it's not very common, but then there's, you're born with those genes that prevent, so there's this bad cholesterol LDL that is cleared by the liver. So you're born with those genetic problems in which that bad cholesterol cannot be cleared by the liver, and it just accumulates. So people as young as 3 or 4 years old, I mean, kids that age, they can have it, but you would have a family history in that. So, I mean, your parents would know that, like, oh yeah, at a younger age, I have it, and those kids even like 4 or 5 years. But yeah, for most of normal people, it's like around 25, you should definitely get your first cholesterol check, and then depending on how you are, either 10 years or every 2 to 3 years, just to keep an eye.
We have a raised hand from Dr. Babu Balagopal, and he will be asking you the question. Babu Cheta, go ahead.
Yeah, thanks, Vinita. First of all, I just wanted to really, thank Dr. Shah for that excellent overview of the cardiovascular risk in South Asians. That was really excellent in the short time span. And before I get to my question, I would like to congratulate Indu and Manofa for organizing this seminar, and Sunita for really moderating very well as always. So, Dr. Shah, my